Hello and welcome to week number 5 of the Smart Start Recreational Therapy Insights YouTube channel by Smart CU's Hub. I'm your host, Nathan Lemaster, founder of Smart CU's Hub, and I've been so stoked to be able to go through this series with you as we build week after week on the foundations of recreational therapy, all onto what type of skills can you use to improve your recreational therapy skill set and tool belt. This week, we're going to be talking about client assessment strategies. So buckle up, sit in your seat, take some popcorn out, whatever it is that you need to do, maybe drink some coffee, and we're going to dive right on in. All right. So before we can ever come up with what appropriate interventions are there for our clients, we first need to assess where they are at. And that is broken down into 3 main areas. It'll be guiding treatment, measuring baseline and progress, and fostering client engagement. So we're going to talk about guiding treatment. A thorough assessment helps us to identify the strengths, needs, preferences, and obstacles our client faces. It forms the basis for goal setting and treatment planning. Without it, we risk just offering generic activities and may not actually address the client's needs. We're going to measure the baseline and progress through doing this assessment. So assessments offer an initial screenshot of what the patient is there for, the client is there for. And we need to know what their physical strengths, weaknesses, opportunities are. We need to know their cognitive, emotional, and social functioning levels. And by revisiting the assessment data later throughout our treatment planning, we can measure the client's progress based off of those goals that we set during the assessment. Assessment interviews and discussions are excellent opportunities to build rapport with our clients. Engaging the clients in their own assessment allows them to be part of the process. It empowers them and makes them feel heard. In essence, the assessment is like a map. It shows us where the client is so that we can figure out the best route to get them where they want to be. Recreational therapists have access to a wide array of assessment tools. Let's look at a few of the commonly used ones. So there are the standardized assessments, such as the Leisure Diagnostic Battery, the LDB. It assesses perceived leisure competence, leisure needs, and motivation. We have the Comprehensive Evaluation in Recreational Therapy, CERT, so CERT. Different versions, so we got the psych, geriatric versions, measure social interaction skills, functional abilities, and even more. The Functional Assessment of Characteristics for Therapeutic Recreation, that's the FACTR. All right, we have observational checklists as another form of assessment. These involve structured observations during activities. They're useful in documenting social interaction, motor skills, and behavioral responses in real time. Interviews and questionnaires, in-person or virtual interviews. When a recreational therapist meets with a client, it allows them to determine what the needs are of that client. Okay, so we will gather information about their interests, past leisure experiences, things that they want to learn, things that they want to be able to do, and we'll also learn about some of their barriers. Okay, and then we also use self-report scales. Simple rating scales such as pain scales, mood trackers that give insight into how a client perceives their own status or challenges. So for instance, if a client has a high pain level, they may not be interested in doing something that aggravates that pain. We also use interdisciplinary collaboration. Sometimes you'll use existing data from other disciplines, PT, OT, speech, psychologists. This can round out your understanding of a client's overall status and prevent duplicate work. Each of these methods have their own strengths. Often we combine more than one approach to get a well-rounded view of our client's abilities and needs. Now let's talk about how to make your assessment process both efficient and client-centered. We're going to build rapport early with the client. Start with open-ended questions. What do you enjoy doing in your free time? Or tell me a funny memory that you have doing something. This helps the client relax and share more generically. We're going to use plain language. We're not going to use all this scientific jargon or other things to try to intimidate our client. We're just going to talk to them like a human being, just like you would or I would want to be talked to if someone was doing an assessment on us. Clients and families often respond better when the process is framed in clear and everyday terms. For example, instead of functional capacity, saying functional capacity with a patient, we might say, what tasks are easiest and hardest for you? We're going to be flexible and adapt. If client struggles with verbal communication, we're going to incorporate picture-based scales or simplified questionnaires. For clients with mobility constraints, we're going to conduct assessment in a space that's comfortable and accessible for them. We're going to observe both formal and informal settings. Some clients might be nervous during a formal interview. I know I would be. Watching them in a casual group setting or during a leisure activity can reveal additional insights into their interests, comfort level, and social skills. So we get to see them in action. We're going to document thoroughly and accurately. Record the date, time, and setting and any relevant observations for each of the groups or one-on-ones that you do with these clients. This data can help track the progress later. We're going to maintain confidentiality, respect HIPAA, and other privacy regulations. We're going to collaborate with the client and work with the interdisciplinary team. We're going to share the findings with our client when appropriate and ask them questions like, does this sound like an accurate picture of you? We're going to work with the nurses, PTs, OTs, social workers, psychologists to create a holistic plan based off of the findings of the whole team, because they're going to look at different things than we are. A strong assessment process sets the stage for everything that happens along the recreational therapy journey. Goal setting, treatment planning, and evaluation of outcomes. When done right, it can truly shape the client's journey in a positive, empowering way. So let's recap the highlights. Assessments are the foundations of providing RT services. Number 2, multiple tools. We use standardized measures, interviews, observations, and interdisciplinary communication to provide a comprehensive view of the client's needs. 3, the best practices include building rapport with your clients, using client-friendly language, adapting individual needs, and thorough documentation. And 4, collaboration with clients, family, and other disciplines so that we can have a seamless, person-centered approach to what we do when we do assessments. All right, so thank you guys so much for joining me again for week number 5 of the Smart Start Recreational Therapy Insights YouTube channel. And I am so stoked. We have talked about a lot of things so far, and we're going to be moving on to week number 6, where we talk about the person-centered approach, which is crucial for all recreational therapists. If you like this series and you haven't already, please like this video, subscribe to the Smart CEUs Hub channel on YouTube so that you get these videos every single week in your inbox. I am so stoked to be able to provide these for you, and hopefully by the end of the year, we have a big gamut of things that you can use in your RT tool belt. All right, guys, I hope you have a great Monday and a great start to your week. And as always, recreational therapists, stay classy.